Zimbabweans in Harare were queuing for kilometers outside one of the capital's main hospitals in the hope of being vaccinated against COVID-19, but many complained there are no jobs to be had. Andrew Ngwenya and his family traveled about 11 kilometers from their home to Parirenyatwa, a major referral hospital where doses were sometimes available. He said he arrived at the hospital one day at 8 a.m. and by noon, less than 30 people had been jabbed.
I was here as early as 3 a.m. I was on number 5. Now it's almost 8 a.m. They are telling us there's no first vaccine. It hasn't arrived. But in the news, we're told that there's a plenty of vaccine which has arrived in the country and is being distributed all over the country and across all provinces.
This is frustrating. Imagine this big hospital with no vaccines. It's shocking. People are desperate.
Later in the day, nurses told people to return home and try another day. A part-time pastor with a Pentecostal church in Ngwenya and members of his flock are now praying for divine intervention, even though they would rather have vaccines. Mike Muromba said he arrived at the hospital at 3 a.m. and was fifth in the queue, but by 8 a.m. had been told there wasn't any vaccine. Zimbabwe is one of more than 14 African countries where the Delta variant is quickly spreading. Earlier this month, the country returned to strict lockdown measures to combat a resurgence of COVID-19 amid vaccine shortages. To date, 9% of Zimbabwe's 15 million people have received at least one vaccine dose and 3.7% have received 2 doses. Across Africa, less than 2% of the continent's 1.3 billion people have received at least one vaccine jab, according to the Africa Centers for Disease Control and Prevention.